I'm delighted now to be joined by the other co-chair of this year's conference, Piot. Peter, welcome. Great to see you. Now, the session that you were chairing this morning is very much looking at new developments in global health. Fill us in on that.
We still have a huge unfinished agenda in global health for communicable diseases, AIDS particularly, but TB, malaria, maternal, neonatal health, malnutrition. There is also a new agenda that is emerging and is already the #1 cause of death and of morbidity in low and middle income countries, particularly outside sub-Saharan Africa. And these are cardiovascular diseases, it's diabetes, it's cancers, and we have also the fact that the world population is getting older and older, which brings with it also new challenges. And the global health community has not been addressing these issues. So we're missing the boat of the future of health problems.
Well, Peter, you say that, but you know, the conditions that you're talking about, they're hardly new, are they? They're not ones we haven't heard of before.
They're not new, but they're now emerging in a big way, and there was the perception that they're problems for rich countries only. And today we know that the majority of deaths due to cardiovascular diseases, to diabetes and so on, they're occurring in low and middle income countries. So it's, in that sense, it's new commented. But also I think that there has also been the perception that, okay, we've got to die from something when we're getting old, so these are not cause of premature death, but that's not the case. People die at a much younger age of cardiovascular diseases, getting diabetes much younger in Asia, for example, than they do in Europe or in the US.
Do you know, but Peter, some would argue this is because we've focused so heavily on AIDS and not on the health infrastructure of the countries concerned.
Well, it was absolutely essential that we concentrated our efforts on a pandemic like AIDS, on malaria, TB, which have been around for a long time, and the results are there, remarkable achievements. And I don't think we would have succeeded in obtaining these results if we would have said, okay, let's first strengthen health systems and so on. You know, the result of that would have been millions of deaths more. So I think we did the right things. But now we have to also look at the other problems, which, when it comes to chronic care, for example, will require much better health systems. But the majority of interventions when it comes to prevention have nothing to do with health systems. I mean, if people stop smoking, smoking is the major cause of cancer and cardiovascular diseases in the world. So a lot of the actions are outside health services. Better health services are not going to solve our health problems.
Okay, what do we need to do now?
What we need to do now is, in the first place, have a political movement putting this on the top agenda and making sure that the funds are there, and while we're building the evidence of what to do in resource-poor environments. Because we can't just apply models of the West with high-tech as a solution, and where in any case we're focusing on the end stages of diseases often rather than on preventing them.
Well, Peter, thank you very much indeed for joining us. I hope you have a good week as co-chair of the conference. I'm sure we'll catch up again with you soon.